Hi, my name is Fiona. I'm the clinical nurse manager of the delivery suite and the emergency and assessment unit here in the Rotunda Hospital, and we really look forward to seeing you all when you present here in labour. So if you're at home and you have any concerns at all, you should phone the emergency room, and the girls there will usually talk you through, ask you relevant questions just to ascertain what is happening. If you're at home and you notice an onset of severe pain that's not going away, your water's breaking, if it's early, so if it's prior to CHERM, which is before 37 weeks, or if you've an onset of heavy bleeding, you should come get an ambulance, come to the Rotunda straight away. That's not an exhaustive list of what you should come to Rotunda for, and during your antenatal visits and your antenatal education you will receive more information on that. But main thing would be any concerns for you or for your baby that you should come into the hospital. We wouldn't recommend generally getting an ambulance for early labour if you're at term and you're low risk. This is just a natural phase, so if you're starting to get contractions at home or your waters go or you have a show, again we would ask you to contact the emergency room and they'll talk you through and give you the best advice. And I think that is the best advice for people, is to phone in. Again, sometimes the emergency room is very busy and maybe you can't get through to them, but in those instances, if you are concerned at home, you come straight into the hospital by the fastest means, whether that's by ambulance or by your own private transport. So when you're coming in labour, you still come in the main entrance and straight into reception, just like you would if you came in for any other visit, but you go to reception, check in, and then go straight into the emergency room. So the same entrance. So there's 3 stages of labour. So first stage, second stage, third stage. So the first stage is early labour. So it's like 0 to 3 centimetres. And this is when loads of things are happening to your body. Generally, if you're not been induced and you're low risk, you're at home when these things are happening. And this is when the cervix is starting to open, pains are starting. You might have a show, your waters may go. And in those instances, we do ask that you contact the emergency rooms if your waters go at the early, so that they can make arrangements for you to come in with a show and with some cramp and pains. Once everything else is fine and you've no concerns, baby is moving, we'd ask you to, monitor this, stay at home, take some over-the-counter analgesia, hydrate well, eat light diet, rest, do something just to try and take your mind off it. The second stage is from 3 centimetres until 10 centimetres. Generally, you'd probably be in hospital at this stage, hopefully on the labour ward. And there you have the options of pharmaceutical analgesia, epidural, pethidine, gas and air, or non-pharmaceutical, using a birthing ball, different positions, using the bath, water, TENS, there are lots of options. And then the third stage is from when you deliver your baby until delivery of the placenta and until bleeding is this hemostasis, so bleeding is stopped. And that's kind of the big finale part. So all the labouring rooms now are private rooms. So our guidance would be, if you have to go for any emergency surgery, we would generally need to remove the nail polish. So it would just make practical sense for either to have just regular nail polish or not to have any when you're coming into labour. And the reason for that is we need to see the nail beds during any surgery, and that is what we would be observing. We have other methods of seeing your oxygen circulation, but that would be one of the things we would look at. So we don't provide the birthing balls, but we do recommend using them. So we would ask you, if you would like to use these, to bring in your own.